And welcome back. We're back at Armstrong Small Eye Care Center here in Winnipeg, Manitoba, Canada. And today we're going to be talking about macular degeneration, also known as AMD or ARMD. And that comes from Age Related Macular Degeneration. And so this is very birthday based. As everybody gets older, the risk for this goes up. So we're going to talk about two types. We've got our dry and we've got our wet. Today we're really going to focus in just on the dry version of the disease. And we're going to try and explain to you exactly what is the macula.
So, straight ahead, looking through the pupil at the very back part of the eye, your macula is our center vision, a fine collection of your cone photoreceptors for your sharp vision, basically the workhorse of the eye.
Sometimes what I'll say when I'm trying to explain this to patients, if you imagine this whole back part is called your retina, we've got an extra special spot that takes the very best pictures, if that's the analogy of the camera.
I like it.
Okay?
Yep.
So if that's starting to degrade or cause problems, and the reason for that is something called drusen.
Drusen are metabolic waste products. Take that. So a bunch of junk basically collects in the very back part of the eye,
right there,
and disrupts the normally very finely organized architecture of the back part of the eye. These pesky little drusens slowly degrade your center vision.
And what kind of symptoms? What do your patients usually explain to you?
They notice a smudge most commonly, right dead smack in the middle of their vision. So they're looking at the TV guide or their crosswords or faces, and it's just there's a little smudge. It's never quite perfectly clear.
And usually follows them no matter where they go. The other one that I get is they'll tell me that they're looking at the edge of a window frame or the edge of a door, and they get a tiny little kink. And so those are some of the very first symptoms. The kinky vision, as we like to call it.
We do now like to call it that.
So we just had a great question from one of our fans in the eyebreak community, and she was wondering what is the difference between that symptom and actually having a symptom from floaters?
Great question. So everyone has a visual floater, a little spot in your vision that just kind of bounces around. You can never,
everyone?
Well, pretty much everyone, right? It seems like it.
Yeah.
And so yeah, you might be able to just kind of chase these little floaters around with your vision. They might move. You can shake
like
your hand. They might kind of drift a bit. Yeah. Whereas with AMD, it's always going to be dead smack right in the middle. Anything that you're looking at or paying attention to, it's always going to be just kind of right there in the same spot, doesn't move, and quite annoying.
You can imagine if you're reading, if you've got a capital R and you miss one of those little parts, it makes it reading really
like
frustrating. Yeah, absolutely.
It's unfortunate.
Yeah.
Yep.
So we want to talk about some of the things when we start to, how do we diagnose this? So obviously we can look inside the eye. We have different equipment to be able to look in, shine lights, and look at that specific spot on your retina, called your macula, and we start to see these little changes. So once you see this change, what are you telling people?
Depends on how many there are and where their vision's at, how old they are. We start to get into modifiable risk factors though. Basically as it means to preserve vision. So early stages, diet is a major portion of this. You want your antioxidant superfoods. So there's a lot of conversation about that, but
watch our next video on ocular nutrition.
Future episode coming up. Plug. So yeah, your antioxidant-rich foods, your leafy green vegetables, spinach, kale if you can, citrus, peppers, blueberries, just basically heavy fruits and diet.
I like to say a lot of any fruit and vegetables that have a lot of color to them. The more color they have, generally the better they are for your eye.
I like it, absolutely.
Okay. Other modifiable risk factors?
Yes, UV protection when you're outdoors, so either a nice big pair of sunglasses or a good hat to block the rays off of the eyes. And smoking, major risk factor here. So for those of you that do smoke, quit today. For those that don't start tomorrow.
The stats show that if you've got two people that both have parents that have macular degeneration, if you're a smoker, you increase your risk by 44%.
Oh,
it's a pretty high little risk factor there.
It's up there.
Yep.
Okay, and activity level. Don't be a couch potato. Active lifestyle is going to promote good cardiovascular health, which then indirectly helps the macula.
Absolutely. Those people who have high cholesterol, have diabetes, have hypertension are definitely at a higher risk for this disease. Okay. Yeah. So the other part is when we do look in and we see some of these, there actually are different stages. And that also comes back to when we start talking about nutritional things, and we'll get into that in our next video. Stay tuned. But also I think it's important that when we look at these, if we see a few, how we describe that or display that or educate you about these little findings. So I often will use the analogy of a few little, we call them liver spots, birthday spots, on the back of your hand. It's sort of the same thing. Even if you got a mole on your neck or somewhere on your skin, we got to watch them.
Keep an eye on it, but
Yeah.
you don't lose any sleep over it.
Yeah, absolutely, especially in the early stages. And there's ways, as we just spoke about, these modifiable risk factors to really try and keep it at bay, keep it in a holding pattern.
I like it.
Yeah,
Sure.
I stole that from you. So thanks again for joining us today on this video about dry macular degeneration. Stay tuned for our next video on ocular nutrition, followed by wet macular degeneration. And don't forget, be wise, take care of your eyes.